The Health and Human Services Committee meeting is now called to order. Madam Clerk, please call the roll.
Alderwoman Green,
Present.
Alderman Gunther,
Here.
Alderwoman Martin, Alderwoman Middlebrook,
Present.
Alderwoman Rice,
Present.
Alderman Todd,
Present.
Chairwoman Ingrassia.
Present.
6 present, you have quorum.
Thank you. If the committee members have had a chance to take a look at the minutes from the December 9th, 2021 meeting, I would entertain a motion to approve those minutes.
So moved.
Second.
Madam Clerk, please call the roll.
Alderwoman Green,
Aye.
Alderman Gunther,
Aye.
Alderwoman Martin, Alderwoman Middlebrook,
Aye.
Alderwoman Rice,
Aye.
Alderman Todd,
Aye.
Chairwoman Ingrassia.
Aye.
6 aye votes.
We are going to, or by your motion, we have approved the minutes for the December 9th, 2021 meeting. We are going to move to item 5 on the agenda, resolution number 170. Just want to be respectful of the fact that we have some members of the public and city departments here to testify, and Alderman from the 12th Ward, you're up, and feel free to introduce the resolution and then have your speakers in order however you would like them to present to us.
Excellent. Thank you, Madam Chairwoman, and thank you, members of the Health and Human Services Committee. Madam Chairwoman, would you let me know if I start to break up due to connection issues? Thank you. The wonders of Zoom governance. Resolution 170 is it calls upon the Honorable Governor of the State of Missouri, Governor Parson, to declare a state of emergency for the city of St. Louis. That phrase, state of emergency, is a bit alarming, right? I mean, after all, it is a state of emergency, but it is a key trigger for additional avenues of funding, personnel, and resources for the city, specifically on behalf of the City Emergency Management Agency for our medical facilities and medical care providers. So the state of emergency is this resolution 170 is the result of much communication between various divisions and myself. And I'm very lucky to have several speakers today speaking in support. I'm going to do a quick scan of the panelist room to make sure everyone's here, because if available, yes. So we have a representative from Dr. Garza's office that I would like to invite to speak first. If it is all the same to you, Madam Chair. Okay.
That works for me.
Thank you. Dr. Garza, would you like to speak, not necessarily to resolution 170, but to the current status of the region's hospitals, personnel, and resources?
Yeah, I'd be happy to, and thank you for inviting me to speak. So I'll just give you sort of a current update on where we are as far as hospitalizations are concerned, and where I believe that we're heading, and then talk a little bit about personnel issues. So right now we do seem to have crested in the pandemic as far as hospitalizations go, and the trend seems to be following with caseloads as well. So people testing out in the community. So right now, and I'm just going to refer to some of the data that we had from yesterday, and I think we send these out to a pretty wide swath of people. So yesterday, we admitted around 120 patients to our hospitals, to our task force hospitals, which include all of the 4 major healthcare systems in the metro area. And our 7-day moving average is around 136 patients. Now that's down from a high of over 200. So we're definitely on the downward slope, but as I tell people, anytime we're admitting over 100 COVID patients on any given day, it is still, we're still in a lot of difficulty. Moving on from there to our hospital census numbers. So yesterday, our hospital census, we had around 800, a little bit over 800 patients in all of our hospitals due to COVID. Now, again, that's down from a high of around 1,400, which we had about 2 weeks ago. but still an extremely high number. And if you compare this to any of the previous waves, it's still above those high water marks. So even though we're doing better than where we were 2 weeks ago, we're still at an extremely high amount of patients, and our hospitals and ICUs are full. Moving on from there, I'm just going to really briefly touch on ICU capacity is still very limited. And so what does that mean? That means that we're not able to take care of as many patients as we would like to, meaning transfers coming in from outside of St. Louis. And we have to delay some care for some patients that would require an ICU stay. For instance, if they were having major surgeries that required an ICU bed after their surgery. And so that makes it difficult as well to manage many different types of patients. From the pediatric side, just very briefly, those numbers have come down as well. From a high of around 60 patients, we're down to less than 30 right now. So that's come down very nicely, and we're very happy about that. But still, kids are continuing to become sick. And then very briefly, just touch on people passing away from COVID. So mortality is always a lagging indicator for the virus, meaning it's always going to come after the hospital stay. So people test positive, get sick enough, come to the hospital, end up in the ICU. Not all of them, but a proportion of them will end up in the ICU, and unfortunately, some of them will pass away. And we're running around 15 deaths per day over the last 7-day average, which we know is going to be sustained for a little bit of time because we have so many patients in our hospitals. Now, as I said, we are on the downward slope, so that's a good thing. But when you start out at such a high level, it's going to take time to decompress the hospital, so to speak. Our models are predicting that we're still going to be full until the end of really around February. Now, we won't sustain it at this 800 patient level. It will come down. But really getting back to where we were pre-pandemic will take us at least till the end of February, beginning of March. So what does that translate into? So a couple of things. One is, you're not able to take care of all of the patients that you need to in the healthcare systems. So other people with chronic conditions that require healthcare are not able to really get optimal care because of the limited capacity. So that's one thing. But the second piece, which I think is more important, is the strain that's putting on our healthcare staff and our resources. So at any given time during the peak of the pandemic, we had over 1,000 of our staff combined throughout the metropolitan area. We either sick or out with quarantine or taking care of sick loved ones or kids whose schools have been shut down. And that puts a tremendous amount of strain on the workers that are there. And you have to remember, this is really the fourth wave that they've gone through. And by far, this has been the most challenging one. And that wears on people. And so many of you know I serve in the military, and the way that I think about this is just continual operations. In the military, you have the luxury of rotating the units in and out of a combat area, but we don't have that luxury in healthcare. Healthcare staff are extremely limited. You just can't create those overnight. And so we've asked our staff to take on really just heroic measures to take care of all of the sick across our metropolitan area, and it's wearing on them. And it hasn't abated with these 800 patients in our hospitals. And so the second piece I would just make about that is there's a lot of moral injury as well to our healthcare providers, especially people that are trying to make decisions about who can be admitted to hospitals, who can go home, which transfers can we take from outside of the metropolitan area. These are really difficult decisions that weigh on our healthcare providers, and they've been under this tremendous amount of strain. And then the last point I'll make is that this is going to be, as with any sort of disaster or sustained sort of operations like this, it's going to take a while to recover. And that recovery phase is going to be prolonged for months, if not years, because of the psychological and emotional impact that it's had on our healthcare services. And so, although we are starting to see some light at the end of the tunnel, it's still a very long tunnel. And we still have a lot of work to do before we can get back to any degree of normalcy. So I'll conclude my remarks there. Again, thank you for allowing me to offer this this testimony, and be happy to answer whatever questions you may have. Thank you.
Dr. Garza, I apologize. This is Chairwoman Ingrassia. I skipped over one of our new protocols. So I guess retroactively, would you please affirm that the testimony you provided was the truth?
Yes, ma'am.
I appreciate it. Alderman Stevens, do you have another speaker?
I do have another speaker, Madam Chairwoman, but I was hoping to pose a question or two, and I believe a few other committee members to Dr. Garza.
Sure. Yeah, we can go through the committee. We'll start with Alderwoman Green.
Thank you, Madam Chairwoman, and thank you, Dr. Garza, for being here today and for all of your work throughout this pandemic. The question I have, I guess, is, while our cases are starting to go down now, I have been following sort of this BA2 subvariant that's picking up in some European countries. And it seems like each time we have one of these variants, it's just a couple of weeks to a month before it starts to impact us here. And countries that we saw had their cases declining are now going back up again, and that subvariant is taking over as the dominant variant. What concerns do we have about this on our already strained hospital capacity, and what can we be doing in the interim as we are going down a little bit to prepare for potentially another wave?
Right. Thank you. That's an excellent question, and something that we've been tracking as well. So the BA2 variant is a variant of the Omicron variant. So it's a subtype of the Omicron variant. So you're right that there have been around the world some slowing or uptick of cases. So the truth is, we're not really sure how this is going to play out. What we think will most likely happen is that it will delay the decrease in cases and hospitalizations over a longer period of time. And the reason for that is Omicron. So if you think about it, Omicron came through very fast and just really, infected a large number of people. So if you think about how do I build immunity in the population, a large portion of our population now has some degree of immunity, whether that's through vaccination or through natural infection. From what we understand about the B2 variant from some of the preliminary data, vaccines are very protective against it. Even some preliminary data suggest that it's even more protective against the B2 variant than the B1. So that's good news. But if you think about who is the available population to become infected with the new variant, that pool decreases every day with more cases that we're seeing. So I think it's more likely that we won't see any large swings in cases and hospitalizations like we saw with the B1 variant. What will most likely happen is that it is more transmissible than the B1. So we will most likely see a slowing of the recovery because the case rates will be sustained over a longer period of time. That's probably the most likely scenario for the B2 variant. Okay.
And I definitely appreciate all of the graphics and everything that you put out every day. It's very helpful. Mm-hmm. One of the things that I've noticed on that is, over time, it seems like the number of people who are vaccinated and are in the hospital has been increasing. I'm wondering do you differentiate between having 2 doses versus 3 doses when publishing that data about who is considered mm-hmm. vaccinated and non-vaccinated?
Yeah, a good question. So our definition for vaccinated is the current definition for fully vaccinated, which is 2 doses of Pfizer or Moderna or the J&J vaccine. So we don't currently track all of the booster doses. So if you think about the 3-dose regimen as sort of the booster dose, and the CDC may be changing the language to make that now fully vaccinated. But we do spot checks. So because it takes a lot of person power to go into the chart and then pull numbers and try and collect those. But what we have found is by and large, very small percentage of people in the hospital represent that booster dose population. So the fully vaccinated are really sort of the 2-dose regimen. Very few of them end up in the ICU, and it's almost unheard of them passing away from COVID. So we do know, and this is parallel to what we see with national data, that having that booster dose is extremely protective against serious disease and death from the Omicron variant. But it is a labor-intensive process, and that's why we don't pull those out separately.
That's good to know. Thank you. No further questions for me today, but thank you so much for being here and for your work.
Sure, anytime.
Alderman Gunther.
Thank you, Madam Chairwoman. Just also wanted to say thank you to Dr. Garza for your work on the regional task force. I know Dr. Eccles is going to speak a little bit later, but also thank him for, I believe, since March of 2020. We've been getting daily updates from the task force and from our health department, which has been very informative for us to share with our constituents. So I guess my only question, Dr. Garza, is in regards to the state of emergency. So because 2 weeks ago when our numbers were skyrocketing and there was a concern about having additional staff coming possibly from the state through the either through National Guard or through other assistance. So now that we're seeing numbers going back down, how do you see this us being able to provide this, the governor being able to provide the state of emergency? Would it be, additional funding and resources? Would it be additional PPE, or what sort of things do you see us being able to benefit from having this declared state of emergency?
So I think, as I think everybody knows, the state of emergency for the entire state was not renewed end of last year, beginning of this year. And the Missouri Hospital Association, of course, put out a document saying that they supported the continuing of the state of emergency for numerous reasons. And so those would still be applicable here. And so that is loosening of some restrictions on available space that we're able to use, so licensed beds, and the using telemedicine resources, so being able to use that. And then the third one, which I think you're alluding to, is the use of National Guard for COVID missions. And so that was sort of the other big piece of that. And so although, the National Guard doesn't come with a whole lot of healthcare assets, meaning doctors, nurses, things like that, but they can do other sorts of things, whether it's patient transport or some of the other things that still need to get accomplished in the healthcare setting that helps to alleviate some of the work that some of our healthcare professionals are doing now. So why is that important? So in addition to healthcare staff being either sick or on quarantine, it just doesn't affect healthcare staff, it affects the entire staff. And so what that does is it places an additional burden on the healthcare staff, whether it's to, clean rooms, deliver food trays, do all of those other things. And so if you can offload some of that work to other people, which we have been doing, our administrative staff have virtually shut down, office work to go and fill those roles. I think that's where some of that benefit would come from. Now, you're absolutely right that the cases are coming down and the hospitalizations are coming down, but we're still at an exceedingly high level.
Yep. Wonderful. I appreciate that answer. That kind of gives us an idea, because I know when the state stopped renewing, or when it did not renew a state of emergency recently, I know that just even we were affected with being able to have help at some of our local food pantries and issues like that as well. So I appreciate that answer to kind of give people the full spectrum of what that means for the city. So thank you very much for your work. Appreciate it. No further questions.
Alderwoman Middlebrook.
Thank you, Madam Chairwoman. Thank you, Dr. Garza, for all of your work. I have no questions or comments.
Alderwoman Rice.
Thank you, Madam Chair. And thank you, Dr. Garza. Again, just echoing my colleagues, thanks for your service. We did not have your colleague in your absence, but welcome back to St. Louis. Thank you for coming back around to us. I guess I don't have any questions. My colleagues asked the questions that I was going to get to, with just really around what does a continuing state of emergency mean for our flexibility to respond as a community in an ongoing pandemic. So I know we talked about the staffing levels. I know that there's some licensure exemptions and some flexibility with licensure with beds and telemedicine, that kind of thing. But just sort of generally, can you talk about what flexibility a state of emergency gives the hospital system as we're continuing to respond to all of these unknowns and these variants? Can you speak a little bit to that?
Yeah, well, I think you hit on all of the high points. So it's really anything that allows us to have a little bit more flexibility in how we operate. That's really the key to that. And you've hit on all of the high points. So being able to expand bed capacity, shifting some work to telehealth, or having National Guard assist with some of the COVID missions, and then the licensure issues, although staffing has been challenging across the board, so it's not like there's a huge pool of people that we could bring in from out of state to suddenly fill the hospitals anyway. So that's a little bit limited, but of course it's nice to have those tools. As far as the sort of the larger picture for the community, I'll admit I'm not as well versed on how that affects the broader community outside of healthcare. But I think you've pretty much covered the waterfront on how that a state of emergency affects the healthcare systems. And it's not just in St. Louis. I mean, this is really affecting a large swath of healthcare across the state of Missouri. And that's why the Hospital Association was so engaged in trying to negotiate whether that would continue or not.
Sure. Okay. And just, this might be outside of your expertise, so feel free to say, that's not my area. But do you know, is there any significant burden for the hospital, like for the hospital systems, or I guess for the state to maintain a state of emergency? I guess I'm trying to figure out the balance between the good of continuing a state of emergency and the flexibility it allows us, and a potential burden for this state or for even the hospital systems to maintain or to work within a system of a state of emergency.
Yeah, so I can't really speak to the burden on the state, whether that's financial or personnel wise, and and when you're sort of adding a state of emergency on top of a state of emergency with the snowstorm, that makes it even more complicated, because of course there's not enough resource. When you're talking about sort of the National Guard, there's not enough resources to go around to cover everything. So I can't really speak to the burden on the state. As far as alleviating burden from the healthcare systems, it's a little bit soft to put an exact sort of amount or descriptor on it. But I think what it does is it at least allows the healthcare systems to be able to be a little bit more flexible with what they have. And so it's difficult to answer in concrete, hey, we're going to be able to, alleviate this much work from a person's plate that's at the hospital, or it's going to allow us to do this much more telemedicine. But I think the point being is that it allows the flexibility. But as far as the cost to the state, I couldn't even venture that.
Sure. Okay. Well, thank you so much for answering the questions, and please thank your staff all the way down to the administrative staff that are cleaning rooms and transporting patients, and thank your nurses, thank your doctors for us. We are all so grateful for all of the work.
Thank you. I will.
Alderman Todd.
I don't have any questions. Thank you.
Just wanted to echo my colleagues' appreciativeness for all the work that you are undertaking with the pandemic task force, all the hospitals, as Alderwoman from the 8th mentioned, everyone from the janitorial, custodial, cafeteria staff through the administrative folks and everybody in between. It's really valued, and hopefully we can repay you some way in the future besides just saying thank you, although it is coming from a heartfelt place. Thank you for your time today.
Absolutely. Thank you.
Alderman Stevens.
Yes, Dr. Garza, likewise, thank you so much for speaking today, especially in relatively short notice. As you can imagine, excuse me, as you can imagine, a resolution requesting a state of emergency has quite a bit of turnaround time. And I've used the phrase herding kittens more frequently than not in these past 2 weeks, but I did want to pose just one question to you. And it's just a broad question. I don't need hard numbers or anything, but would it be fair to say that the greater metropolitan area of the city and county of St. Louis, our hospitals, our medical care facilities, our nursing homes, so on and so forth, don't serve just the immediate area, but really serve Eastern Missouri? Would it be fair to say that?
Oh, yeah, without a doubt. You know, and this isn't taking anything away from our rural healthcare partners either. They've been under tremendous strain as well, and even more so during this latest surge. And because we haven't been able to, you know, take as many transfers as we could because there's just no space. So I think I mentioned that earlier before. But without a doubt, the St. Louis metropolitan area is the resource for healthcare for the eastern part of the state. And as I had mentioned before, it is difficult for us to not be that resource for our rural partners. It just comes down to sheer numbers. Once we're overwhelmed, we would be offering substandard care to take people in while we're overwhelmed. And so one of the best ways for us to be that resource is to help get our patients well enough to go home.
Excellent, thank you. Health and Human Services Committee, I'd hoped to direct your attention to an article in the handouts file regarding a woman down in Fredericktown, Missouri, essentially where I hail from, who had to be put in a sort of ad hoc ICU that utilized supplies bought from Walmart, which is ingenious on the doctor's part. However, I can see that I did not submit that as a supporting document, so I will correct that for tomorrow. There are other supporting documents I'll reference though. Dr. Garza, I would like to thank you as well for, again, coming out on late notice and for speaking to this. I appreciate the military framing of, you know, in active military operations, you can switch teams out, right? You can rotate people, you can give people a break. And our healthcare workers across such a broad field have not had that for 4 waves now, you know. I also want to apologize to you in that this is just a resolution asking the governor to take action. I cannot compel the state. None of us can compel the state to actually enact a state of emergency. I want to be thoughtful that I don't end up patting myself in the back. Job well done, Bill, for typing up a resolution. And more broadly, apologize that even though I am an elected official, I can't do more, or at least I don't know how to do more to support this. This is a crisis to me, and this is one of the regrets in office, being unable to respond to this crisis. So I appreciate your ability to have responded to this crisis and to continue responding to it, and to assist us today in taking the steps that we can as a legislative body to help support not our work, but your work. So thank you, Dr. Garza. That's all I've got. Appreciate you.
Thank you.
Do you have another speaker? Sure, yeah. Do you have another speaker?
Yes, I do, ma'am. Madam Alderwoman, Madam Chairwoman, rather, I would like to invite Ms. Shonda Whitfield, who is a medical care provider herself and a member of the public, to speak. She submitted a written statement for the record, which is in the file. And Ms. Whitfield, if you are present, I would like to invite you.
Good morning. Are you ready to speak?
Yes, ma'am.
Just quickly, do you affirm to tell the truth in your testimony?
Yes, I do.
Thank you. Please proceed.
I would like to start by saying, good morning. Thank you for the opportunity to speak to the committee. I'm here to speak in favor of Resolution 170, which calls for a state of emergency declared from the governing parts. My name is Shonda Whitfield. I work at East Stacy Spanish Lake as a certified nurse assistant. I've been there more than 5 years. I'm also the senior shop steward at my facility, so I act as the voice of my coworkers. I want to start by sharing what it has been like over the last year. Oh, wow. Our union represents more than 1,000 healthcare workers who either live or work in the city of St. Louis. As the COVID-19 ripped through our city starting on March of 2020, healthcare workers were put at tremendous risk, just a terrible risk. Our SEIU members are at the front line in hospitals, nursing homes, as well as home care aides. Our members includes the cooks and housekeepers, the certified CMT technicians, a certified nurse assistant as I am, the laundry and the cleaning staff. These were the workers that I am entitled and united in my union with. Many of us in these jobs are people of color, and Black and brown people are almost three times more likely to die from the COVID-19, according to the CDC. We have been risking our lives and our loved ones to care for our clients, and we don't get paid very well to do this work. Some of us only earn the state minimum wages of $10.30 an hour, which just isn't enough. As a union, we have won paid increases. Most nursing staff in union facilities now get $15 an hour for nursing staff. But we still need your support to make sure that all the dietaries, the laundry people, the housekeeping staff starts at 15 in the near future. We have been risking our lives to save others. Many of us have gotten COVID, including me. It's not a pretty feeling. I've suffered and lost time and was not paid for it. We have even lost some of our coworkers as well as our residents. God rest their soul. We need help and we need it now. We are worn out, very tired from the day in, the day out, working short, working double shifts, having to sometimes stay there at the nursing home because we have no relief. The COVID-19 pandemic has shed a light on many of the cracks in the healthcare system. We absolutely cannot allow business as usual to continue after what we've been through the last year. Management and unauthorized out state owners who are trying to break our union can't continue to run our facilities with inadequate staff. Their bad business practices are forcing us to work harder and harder every day, which is dangerous for both the workers and the patients that we care for. Management also can't continue to give an inadequate PPE, no hazard pay, no paid time off when we get vaccinated. We want the respect, the protection, and the adequate pay. The resolution of that declaring a state of emergency will be an important first step towards getting our healthcare system the help it needs. Here's two of the things. We would also like to see a worker support officer added to the city health department. Healthcare workers this desperately needs a worker safety officer who can hear complaints, and we won't be scared to report the safety issues that's going on in the work hazards that we're working in. Hold public hearings and fix safe working conditions for healthcare workers. We also believe that the healthcare infection control training program that we have developed could be a great step forward. If we can receive some support from the city for this program, we can start on goals for training 600 healthcare workers in 2022. But let me restate our hearty support for Resolution 170, a state of emergency for the city of St. Louis. We support this important measures, and thanks all the staff and for inviting us to participate in this meeting today. Thank you so very much. But it is very greatly needed for a state of emergency because we are tired, we are overworked, and it's stressful, and we're steady losing coworkers as well as residents. And it's a heart-filled thing when we have to come home and see those things. Sometimes it's like a nightmare living over again because you're seeing more than one or two dying daily from this pandemic. Thank you so very much for taking the time.
Thank you for your candid and compelling and heartbreaking testimony. It's appreciated, and that it's important that we hear from people like you on the ground undertaking this work. I'm just going to go through the committee quickly to see if anyone has any questions or comments. Alderwoman Green.
No questions at this time, but thank you so much for the work that you do, for the work that other SEIU members are doing, and thank you for taking the time out to come and speak with us today.
Thank you.
Alderman Gunther.
No questions as well, but just thank you for your work.
Thank you.
Sorry, Alderwoman Middlebrook.
I have no questions now, but thank you for all your work.
Alderwoman Rice.
Yes, also no questions at this time, but thank you so much. And please pass on our thanks to all of your colleagues as well.
Alderman Todd.
I don't have any questions. Thank you for your work.
Alderman Stevens.
To echo my colleagues, thank you for your work, of course, during all this. Thank you for your resilience, your perseverance, and your sticking with it. And to you as well, I will apologize and say that this resolution cannot fix the situation. It only hopes to get us closer to making it better. So again, my regret that it's only a resolution, but thank you for your work. Thank you for saving lives and making them more comfortable. So with that, I would yield back, Alderwoman.
Okay, do we have another speaker to testify?
Yes, ma'am. I guess I won't yield back. I would like to welcome Commissioner Russell of the City Emergency Management Agency, who is so kindly agreed to speak today to sort of the more bureaucratic side of what a state of emergency is and what that means in terms of access to various supplies and relief efforts. So they should be.
I see them.
Thank you.
Commissioner Russell, always good to see you. Do you affirm that your testimony today will be the truth?
I do. Thank you, Madam Chair.
Thank you. Please proceed.
So in conversation with Alderman Stevens, we talked about, kind of the groundwork for these emergency declarations and what they provide. And since some of this was covered during Dr. Garza's testimony, I won't, belabor and take everyone's time to kind of go over that. But that was really at the core of why this exists. That's a good explanation. It really opens up the types of things that we're able to do to provide the needed resources in an emergency situation to meet the needs that we're not able to meet at the local level. And certainly for a prolonged incident such as a pandemic that does become more critical over time. So the groundwork is laid by a number of different means, but what I will just briefly speak to today is there are national standards that have been created. We do work within the National Incident Management System, which lays a groundwork and a system for us to operate in for emergency responses to natural hazards or man-made hazards. We also function within the Incident Command System, which again gives us a common operating picture. So some of the things that may sound familiar from, of course, military service, like Dr. Garza spoke to, similar protocols and procedures can be assigned to first responder disaster response agencies. And that really allows us all to be able to, kind of share that load and in certain situations be able to easily go from one location to another and plug into their system. So, in the case of any other natural disaster, if I were to pick up and go to Kansas to help after a tornado, it's a common practice that we're doing. We're all kind of already on the same page of what needs to happen and whose responsibility that is. That's just the basic framework for all, emergency response. As part of that, there's also presidential directives. I would note Presidential Directive number 5, as well as the Robert T. Stafford Act. And those speak specifically to emergency response and the ways these disasters or emergencies begin locally and they end locally, but they're able to be scaled up. When our local capabilities are taxed and we still have needs, we can elevate that to the state level to ask for assistance. That's our next step up. And then as we continue to expand, if the state then doesn't have the resources to meet those needs, they would elevate again to the federal level for assistance. So in our typical, pathway of working on these type of incidents, once we are taxed at our local level, our next step is to ask the state for resources. And again, that is certainly easier, and the needs are more easily met when there is a declaration in place. And that's one great example of how, this process is set and has been developed to work towards making sure the needs are met. And that's basically what we've been dealing with throughout this. I would, echo everyone, I think on this session already. I've been fortunate enough to meet with our regional healthcare providers and some from across the state at least twice and usually 3 times a week throughout this pandemic. And certainly, there's a lot of us that this is our calling. This is what we do. This is what our life work is about. And, for a long time, we will push as hard as we can to just make sure the job gets done and the need gets met. Sometimes no matter what the cost to us or our physical body may be. And certainly it has been, you can tell by the tone in people's voices sometimes when, as we hit the peak of one thing, you can hear the toll in the voices, especially when you're doing a Zoom or a phone call with people throughout, the week. So certainly, the Delta variant was very taxing. Omicron became more taxing right beyond that. We are kind of at that, as Dr. Garza spoke to earlier. We've kind of hit a peak and we're starting to come down a little bit. You can hear some relief, certainly. We can see it in the numbers, but this is a very long operation for everyone, the public, the government services, and certainly healthcare providers, from the top to the bottom of the system. We know we still have needs. We do have a federal team within our region now. Our healthcare providers work very diligently to place requests for assistance that were elevated to the federal level and got that team here. This system can work, but this is why it was put into place for incidents just like this. So hopefully, like I said, I don't want to go back over everything that came up during Dr. Garza's testimony, but it really does open the lines for us to be able to get needed assistance and help, whether it's a specific timeline on a certain licensure or practice that we have implemented, that's a little more lenient because of some changes we're able to make during a state of emergency, or just freeing up money or resources to be able to kind of backfill and take some stress off of pressure points. And that will conclude my testimony. Thank you.
Thank you so much, Commissioner. Alderwoman Green, do you have any questions or comments?
No questions, just thank you for your work and for being here today.
Alderman Gunther?
No questions, just thank you as well.
Alderwoman Middlebrook?
No questions, thank you.
Alderwoman Rice?
Thank you, Madam Chair, and thank you, Commissioner, for being here, particularly in the middle of a snow emergency. So thank you for your work as well. And I'm curious, I believe it was Alderman Gunther that was talking about some potential impacts on food pantries that happened when the state of emergency ended. And I'm wondering, are there any other areas that you can point us to that a state of emergency helps as far as those types of things, so food access, or getting of PPE for us to distribute, so anything outside of the hospital system that you can point to?
Certainly. Look, speaking specifically about food pantries, I think we all have seen over the past couple of years in news coverage and stories about food pantries and distribution. In a lot of that in our local area, there were uniformed service members, National Guard, that were assisting with packaging and distributing those goods. That was in place, that they were being used for that reason because that declaration was in place. It depends on where the need is and where those resources are assigned to be used. In that case, for food pantry help, certainly we saw some other uses as well. If it was PPE distribution or helping to move it from one place to another, making sure it gets here. In some cases, it could have been funded as well through some different fundings. We did, of course, have CARES Act funding. We still, in the city level, are doing a lot of FEMA reimbursement projects for certain expenses and costs. And that's something that, happens every day in my office, is working on those projects. It just depends on, again, the request process, where the most need is, and then coordination from that state level to assign those resources to us when they're available and have been requested.
Okay. All right. Thank you so much. Thanks for being here today.
Alderman Todd?
I don't have any questions. Thank you.
Commissioner Russell, thanks again. And please keep this committee posted on how we can be helpful in terms of putting in time or assisting and supporting all of the efforts that you've undertaken. I can't imagine how exhausting it must be to have to continue this work going on calendar year 3.
Thank you.
Sure thing. Alderman Stevens, do you have any other speakers?
No, I would like to apologize to Dr. Eccles, whom I did not reach out to, which was thoughtless on my part. I should have reached out to Dr. Eccles for this invitation. I did not, and that is on me. So my apologies, Dr. Eccles. But otherwise, I do not have any more speakers, and I'm willing to present this to the committee for consideration.
Okay, yes, I would entertain a motion to pass this resolution out of committee.
So moved.
Second.
Previous roll.
Hearing no objection to previous roll, resolution 170 comes out of committee. And thank you for everyone's time. Alderman from the 12th, thanks for bringing this in front of us today. And we will see this on the agenda this coming Friday at this Friday's board meeting.
Yes, thank you.
You're welcome. At this time, I'm going to turn it over to the Alderwoman from the 2nd to chair the meeting. I have a few board bills that we need to plug through before we adjourn.
Alderwoman Middlebrook, I think you're on mute.
Thank you. I am so sorry. I apologize for any background noise. I have a 4-year-old here who is excited and looking out the window about snow. So we will go ahead with Board Bill 166, Madam Chairwoman.
Thank you so much. Board Bill 166 will authorize the Department of Health to accept a COVID-19 grant assistance of up to $1.4 million from the Missouri Department of Health and Human Services. The grant funding will be used to assist with contact tracing, data reporting, COVID-19 testing, health education, all to reduce the community spread of the virus and outbreak response expertise development. And I have Dr. Eccles here who can provide more specific information. So if anyone on the committee has questions for either of us, we're happy to answer those.
So thank you to the committee and Chairwoman Alderwoman Ingrassia. As you stated in your statement, the epidemiology and laboratory capacity enhancing detection grant that's being provided by the state of Missouri, the Missouri Department of Health and Senior Services to the City of St. Louis Department of Health in the amount of $1,444,604 will give us additional resources that will assist with our COVID-19 response efforts, particularly in the areas of case investigation, contact tracing, public health surveillance, COVID-19 testing, health education and information that promotes the reduction of community spread and professional development or activities aimed at building infection prevention and control and outbreak response expertise within the health department. We have reached out to the Missouri Department of Health and Senior Services for this grant, as well as the original epidemiology and laboratory capacity grant, which is amended, which is another board bill that'll be presented later regarding a specific request to use some of the funding for the purchase of antigen tests for city residents, as well as personal protective equipment to make those available to populations who may not have those have sufficient funds or resources to purchase them. And so the ultimate goal is to make sure that we are using the funds to address gaps that have been identified in the local public health system as we continue to navigate through the COVID-19 pandemic.
Thank you, Dr. Eccles. Madam Chairwoman, do you have any thing else to add to that?
I do not, thank you.
Okay, we will take questions from members of the committee. Alderwoman Green.
No questions at this time. This seems pretty straightforward. So thanks for coming before us today.
Alderman Gunther.
No questions either. Thank you for putting this together.
Sorry, Alderwoman Rice.
Thank you so much, Madam Chair. Dr. Eccles, there has been some conversation in the news lately about contact tracing and about how we've not been able to do that as successfully as we were, at the beginning of the pandemic. Is this grant going to help assist in those efforts to make our contact tracing more robust?
Yes, so also the health department issued an RFP for contact tracing and case investigation about a month ago. And so that has closed. And so we're sorting through those proposals that have been submitted. And we will likely use some of the funds to enhance our capacity as it relates to contact tracing and case investigation. However, we are mindful of additional guidance that's come down from the Association of State and Territory Health Officials, the National Association of City and County Health Officials, and the Council of State and Territorial Epidemiologists, and the American Public Health Laboratory Association regarding how we're going to transition contact tracing and case investigation activities to a point where we prioritize certain populations, such as the pediatric population, as well as the elderly population, particularly when outbreaks or clusters are identified in long-term care facilities. So those will have the highest priority. And then others, we will conduct case investigation activity, but not as in-depth as we have been over the last 2 years. And ultimately, the state of the national organization are working to move us toward a state of endemicity. And so and that looks like treating potentially COVID-19 cases similar to how we approach flu cases. So if there are any outbreaks, we really prioritize those, and there are specialized populations that are at higher risk. Then we prioritize those cases compared to just the general population. And that's necessary to really sustain the public health workforce, because we know that before COVID-19, a lot of the local health departments did not have sufficient capacity to do contact tracing and case investigation at the level that we've had to do over the last 2 years. So having those hundreds and hundreds of cases reported daily and having staff to reach out to every single case and their contacts was really a capacity that the local public health departments did not have. And so as we transition from this current state to a state of endemicity, that's one thing that we'll be doing. There's a document that was shared by the agencies that I mentioned before, and we can share that with the group, and it really outlines their recommendations as it relates to contact tracing and case investigation moving forward through the COVID-19 pandemic.
Okay, and are we still using there was a sort of novel automated system that you had described towards the beginning of the pandemic that was reaching out to folks maybe through text message or through automated phone calls. Are we still utilizing that system, or is it more manual now?
It's still an option, but most of the individuals opt to opt for the manual option. So,
okay, thanks so much.
Mm-hmm.
Alderman Todd.
No, I don't have any questions. Thank you, Dr. Echols, for coming.
Okay, thank you. And Alderwoman Ingrassia, do you have anything else to add?
No, just in closing, I would ask for your favorable consideration of this board bill.
Okay, thank you. Sharita, can you please call roll?
Oh, make a motion.
Sorry, can we make a motion for Board Bill 166?
So moved.
Second.
Do you want to specify that we pass it with a do pass recommendation?
Yes, I'm sorry, pass with the do pass recommendation.
So moved.
And second.
Previous roll.
Hearing no objections to previous roll, Board Bill 166 has been passed out with a do pass recommendation. Thank you. We will move on to Board Bill 168. Chairwoman Ingrassia.
Thank you, Chairwoman Middlebrook. Board Bill 168 is another grant opportunity that the Department of Health is able to take advantage of. This will allow them to accept a NACCHO grant of up to $500,000. This money will help run a program through this year until June of 2023 in partnership with PreventEd, who will serve as a subrecipient to implement research-based prevention and early intervention practices for drug, alcohol addiction, and mental health services, and for programs in St. Louis City Public Schools. And I will turn it over to Dr. Echols to provide some more detailed information.
Thank you, Chairwoman Ingrassia. Back in September of 2021, the Centers for Disease Control and Prevention and the National Association for County and City Health Officials contacted me regarding the city's ability or inability to implement substance use disorder prevention activities. And so at the time, based on the city's social vulnerability index, it was a high priority for those agencies to provide additional resources to really assist with capacity to implement substance use disorder prevention activities. As we looked at the system and what was currently happening, there was some other activities that we were planning to do or looking into doing as it relates to working with fire and EMS, but we also wanted to consider working more upstream. And so working with school systems to implement curricula that could really help inform our younger population about the impact of substance use disorder and potential complications that come along with that. And so we looked across the system as well and looked to identify a partner that has a history of actually providing evidence-informed curricula for substance use disorder, and Prevent Ed has been at the front of on the front lines in that particular arena for a long period of time. And so we're working with them to implement or expand the work that they're already doing in schools to implement curricula focused on substance use disorder prevention, particularly in middle and high school students. And so that's the proposal that was submitted to the CDC and NACCHO. And so far they've agreed with the scope of work. And so right now we just need your approval to accept the funds that will be issued by those agencies.
Okay, thank you, Dr. Echols. We'll go ahead and take questions from the committee. Alderwoman Green.
No questions, thanks.
Thank you. Alderman Gunther.
No questions.
Thank you. Alderwoman Rice.
No questions at this time. Thank you.
Thank you. And Alderman Todd.
No questions.
Thank you. And I have no questions. Chairwoman Ingrassia.
Thank you. In closing, I would hope the committee would pass out Board Bill 168 with a due pass recommendation.
Thank you. I would like to entertain a motion to pass out Board Bill 168 with a due pass recommendation.
So moved.
Second.
Previous roll.
roll.
Thank you. Hearing no objections to previous roll, Board Bill 168 has been passed out of committee with the due pass recommendation. We will move on to Board Bill 169. Chairwoman Ingrassia.
Thank you. Board Bill 169 was recommended by the Board of Estimate and Apportionment, authorizing the Department of Health to accept an additional $55,000 from the Missouri Department of Health and Human Services for local COVID-19 response. The money will likely be used for various types of PPE, including KN95 masks. And Dr. Echols can provide some additional information for the committee.
Thank you, Alderwoman. So I think you hit the nail on the head. So this is the Epidemiology and Laboratory Capacity Grant that was issued to this City of St. Louis Department of Health. This is the first amendment to that grant, giving us additional $55,000. And again, the goal is to provide additional resources to enhance the City of St. Louis Department of Health's capacity to continue to navigate through the COVID-19 pandemic. And one specific request that has been made to the Missouri Department of Health and Senior Services is to be able to use the funds to purchase PPE and antigen tests for City of St. Louis residents.
Thank you. We will go ahead and take questions from the members of the committee. Alderwoman Green.
Thanks. Just one question. Do we know how, once we receive this funding and are able to purchase the PPE, that'll be distributed to the community?
Yes, so there'll be a tiered approach because there will be limited resources. So city employees will receive resources, as well as Dr. Mott has been working with the schools. So school teachers will also receive resources, particularly antigen tests. And then we'll be working with other priority populations and working with likely the libraries to establish distribution points for city residents to access resources as well.
Okay, great, thanks. No further questions.
Alderman Gunther. Alderman Gunther.
I have nothing.
Okay,
Thank you.
Alderwoman Rice.
Thank you, Madam Chair. My only question on this, it looks Well, about how much is there a quantity that we can say that we're going to be purchasing? I know pricing can vary, but is there a quantity of tests and a quantity of PPE that we're expecting to be able to purchase from this grant?
So we're still working with the Supply Commissioner's Office. So they received the request for quotes, and they issued the request for quotes, and then we work with them to determine the amount based on the quotes that have been submitted to their office. So Dr. Mahdi and other members of the health department staff are working closely with Chris Carter and his team to identify that amount.
Okay, and do we have a ballpark of how many residents might be able to access resources through this, or we just don't know yet at this point?
We don't know yet at this point.
Okay. All right. Thank you so much.
Okay, Alderman Todd.
I don't have any questions.
Okay, thank you. Alderwoman Ingrassia.
Thank you, Madam Chair. In closing, I'd request that the committee pass Board Bill 169 if the due pass recommendation.
Okay, thank you. I would like to entertain a motion to pass out Board Bill 169 with the due pass recommendation.
So moved.
Second.
Previous roll.
Awesome. Okay. Hearing no objections to previous roll, Board Bill 169 has been passed out of committee with a due pass recommendation. And I will hand this meeting back over to Chairwoman Ingrassia.
Thank you for your help, Alderwoman Middlebrook. Before we adjourn, does anyone have any announcements? Madam Chair, would you please excuse Alderwoman from the 11th for necessary absence? And I will entertain a motion to adjourn.
I'll make a motion to adjourn.
And second.
Second.
All in favor, signify by saying aye.
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 Thanks for your time, everybody. Stay safe out there. Have a good day.